Okay, well, I think we're going to go ahead and get started, and we'll have others who will jump on. So I'd like to welcome everyone to our first virtual Rare Disease Day event for Virginia, who's joining in every other state virtually, and everyone's used to that. I know you are. My name is Jana Monaco, and I am the Rare Action Network State Ambassador for Virginia. And I will be leading you with my fellow NORD peers on this event. And as you will see in the chat room, we have the medical disclaimer put out by NORD. You can take a look at that as you follow along. And the chat box will be available if you have questions or comments to make at any point during our presentation. And I am joined, as I said, by the rest of our NORD team. And we are just excited to be able to kick this off in light of pandemic. And we've got lots of great things to share with you this evening. So with that, I wanted to welcome our speakers as well after we have a few NORD videos. As every year, NORD shares the Rare Disease Day video, which always has a different theme. So we will go ahead and begin with that. If you haven't seen it already, it's quite a nice video. Can everyone hear that? I'm not getting sound.
No,
Yeah,
no sound.
sorry. Give me 1 moment. This is our first time embedding the video into the PowerPoint because it wasn't working great on other calls. So let's see. I'm just going to unmute myself and I won't talk.
No sound yet.
There's still no sound?
No sound.
Oh.
Yeah, I wonder if it'll work through the YouTube link.
Yeah, bring it up on YouTube and then just share that. It should work.
All right, give me a moment.
It couldn't be without any glitches. I said these are
Works.
eight Rare Disease Day events happening today that the teams have had to manage all day.
Sorry, 1 moment.
Bear with us, everybody. It's worth watching. And then we will have another one from our NORD president afterwards.
All right, I got it. Ready? I'm gonna reshare my screen. I have to find, there it is. All right, okay.
Still no sound.
There's still no sound?
Oh.
Okay, well, maybe towards the...
Oh, wait, hold on. Sorry, 1 second. Tell me if this worked.
Here we go.
Jeg Jon Christian, og jeg bor I Norge.
I live in the United States of America.
In Australia.
Malaysia. No Brasil.
Tunaishi, Kenya.
My passion is for fashion and design.
I love to dance.
Minnesota. Para viajar e descobrir novas culturas.
Anapenda kunitazama nikipuliza mapovu. Jeg elsker idrett og spiller spill med familien min.
Minhas paixões são minha fuga quando as coisas estão difíceis. Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah.
When your disease makes you feel isolated.
It's difficult to walk. Å være med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumwona mtoto wangu wa kiume anavyofurahi tunapoenda nje, nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik perhubungan dengan masyarakat yang tak pernah saya sedar wujud.
Och vara överhängig på grund av människorna runt mig.
There is support.
Sua bondade inabalável.
The big one.
Mina vänner,
Keluarga,
Enfermeiras,
Doctors.
Support workers.
assistenter, mashirika ya wagonjwa.
Together, we are a strong community.
Nimeweza kuelekewa.
histórias compartilhadas que me libertaram das dúvidas.
Och gammal självtillit.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has CASC, a neurological disorder.
saya Syafiq dan saya hidup dengan ectodermal dysplasia.
Regina, eu tinha leiomiosarcoma, câncer raro.
Huyu ni Harvey. Ana SMA, spinal muscular atrophy. Johan Christian och jag har OI, medfött benskörhet.
Esta é minha vida.
Suara saya.
And I am more than my disease.
We are rare.
Kami ramai.
Nós somos fortes.
And we are proud.
All right, I'm going to go back really quickly to the PowerPoint slides if I is this happening.
Thank you. I thought that was a really great video, worth waiting for. It's always great to see what comes out every year.
All right. Sorry, hopefully no technical difficulties after this.
We have one more with the president of NORD. And there he is. That is Salsenstahl, so it'll be great to listen to him.
All right.
That one will probably work.
Welcome. I'm Peter Saltonstall, President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. But before we begin, I'd like to send out a special thank you to all those advocates and others who have spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today, and some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the Rare Disease Advisory Councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a reality. Without your continued support, none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community, and we must always remember that alone we are rare, and together we are strong.
That really does kind of sum up our year, I think, everybody can relate to, and the inequities that Peter talks about for just the entire community really is something that is even greater in the rare disease community, which I think we can all attest to. So with that, we will move on into our agenda, and we've got a great one. We are going to talk about the RDACs, the Rare Disease Advisory Councils, the state report card. We will get into, and then we will get into our speakers. And as I said, I am Jana Monaco, and I am a parent of 2 children with a rare disease. It's a rare inborn error metabolism called isovaleric acidemia. And I'm joined with Allison this evening as well, and I'll let her introduce herself as herself a patient as well. But we've got great speakers, and without further ado, we're just going to go right into our own presentation.
Yeah, so, right thing. Okay. Sorry, I'm working on it. There we go.
There we go.
Anissa's gonna
We have Anissa Reed.
Yeah.
Awesome. Hi, thank you all so much for joining us today. I'm Anissa Reed. I'm the State Policy Manager here at NORD for the Eastern Region. Next slide. Perfect. So I'm going to do a quick overview of Rare Disease Advisory Councils and what they are and why they're important. So let's start with the problem. So more than 25 million Americans are living with one of more than 7,000 unique rare diseases. So that breaks down to about 1 in 10 Americans. Even though that may seem like a lot, state decision makers often have limited awareness of the issues and impact that rare diseases have on patients, their caregivers, and the overall healthcare system. Next slide, please. So what's the solution? NORD believes it's to create RDACs, a diverse body to advise state government on the common obstacles that the rare disease community faces. We see this as an enormous opportunity for government officials and the rare disease community to work together to develop resources necessary to prevent and address barriers in a strategic way. There are a number of differences between RDACs in each state. This includes the number of members, where the council is represented within, differences on their duties, but overall each RDAC has the same goal, which is to support the rare disease community by increasing the voice of rare disease patients and caregivers at the state level. Next slide, please. Great, so to date we have 16 states that have passed RDAC legislation. And we also have several other states with RDAC bills that are currently being heard. And we're really excited to report that Virginia is one of them, and it just passed through the General Assembly. Next slide, please. So as mentioned, we're thrilled to have had such an active year and upcoming session with RDACs. And so we want to really continue to increase the number to give as many rare disease advocates a voice in state government as possible. So NORD highly encourages that different state RDACs collaborate with one another to share ideas and best practices. We plan to continue to develop and release toolkits and one-pagers, host webinars, and convene additional meetings to support ongoing RDAC work. Next slide, please. Great, so we are so excited to report that Virginia's rare disease community has had an exciting few months in the Virginia General Assembly. House Bill 1995 was introduced by Delegate Kathleen Murphy, who we are so excited to have with us today. A few duties that the Virginia RDAC will likely have is to hold public hearings to learn about the impact of rare diseases on individuals in Virginia, conduct research to provide policy recommendations on how to improve access to specialists and healthcare services for individuals with rare diseases, and publish publicly available resources about rare diseases on the council's website. So Jana and Allison have done an amazing job getting the bill across the finish line. They've both submitted written testimony, and Jana recently orally testified and shared her powerful story about her connection to rare diseases. So the bill is currently on the governor's desk awaiting a signature. So we are hoping to have it signed into law within the next few days or so. So exciting update for Virginia. Next slide, please.
All right.
So I'm going to hand it back over to Allison. Thank you.
Yeah, hi everyone. My name is Allison Harrity. I am an administrative assistant in NORD's DC office. And as Jana mentioned, I'm also a rare disease patient myself, and I am a fellow Virginian. So I'm from Arlington, Virginia. Lived here my whole life. So that is a little bit about me, and I'm going to be going over NORD's 6th edition of our state report card, which we just recently released. I worked a lot with the policy team on the state report card. I previously interned for NORD before I was an administrative assistant here, and this is a project that I've consistently worked on over the past 3 years. So it's, I worked on the 4th and 5th editions of the report card as well. So it was fun to get to work on it a bit more and be a part of the exciting transition that I'm going to talk about in just a minute. But just a little bit of an overview of the state report card and the issues that we focused on in this year's edition of the report. So we talked, or in the report, we assessed state policies in 50 states and Washington, D.C. regarding medical nutrition, Medicaid financial eligibility, so your income level to qualify for Medicaid in your state, newborn screening programs, patient protections for prescription drug out-of-pocket costs, one section called Protecting Patients in State Medicaid Programs, which evaluates 1115 waivers and whether states have implemented 1115 waivers that may be harmful to the rare disease community. Protecting Patients in State Regulated Insurance, which assesses whether states limit short-term limited duration health plans, which are plans that often have high deductibles and don't comprehensively cover the essential health benefits that are required under Affordable Care Act plans, rare disease advisory councils, which you all know about, and step therapy, also known as Fail First. So something that was exciting about this year's edition of the state report card is that because of COVID-19 and everything being really virtual this year, we transitioned the report to an interactive digital format, which we hope will also just make it more accessible generally. It previously was mostly distributed in a written format. And so we have a little video here that hopefully will work just to give a little walkthrough of the state report card website. And before I do that, I just want to note that printable versions of each of these pages are available for when we do go back to in-person meetings and you're bringing handouts and things like that. So that is a thing that's available.
So here we have the landing page for the 6th edition of the NORD State Report Card. We've just got a little intro text up here, and then we have the 8 issues that we assessed in the 6th edition of the report right here. If you go over here, we have a drop-down bar where you can click and select your state. And then right underneath of that, we have all of these patient stories about some of the issues that are focused on in the report card. So now I'm just going to navigate to one of the issue pages. I'm going to click Medicaid financial eligibility, and that'll take you to this individual issue page. We just got a little bit of intro text again at the top, and then some more text about what the issue really is and why NORD cares about it. Underneath, then we have some text about the grading methodology for this section, as well as the rubric, which is available at the bottom and also underneath of the map right here. Again, we have that drop-down bar where you can select your state. Then if you go to the left over here, you can click and access all of NORD's policy statements on the particular issue. And then you can also click and access the appendix for that section. So next, I'll look at the map a little bit. So you can hover over each state on the map and see the state's overall grade, which is bolded there for this section, as well as the subgrades that were averaged together to get that overall grade. If you click on any of the states, it will take you to that state's individual state report card page. So I clicked on Virginia, and here is Virginia's state report card. If you scroll, you can see that we have all 8 sections and their overall grade up here in orange, and then the subgrades underneath. And you can also click this right here if you want to open a printable version of the individual state report card.
All right, so that was the virtual kind of tour of the state report card website. As you might have seen, because I made the video, Virginia was the state that was selected, and it is the state on the video for every single Rare Disease Day event. So Virginia gets a little call out in every single state. But yeah, now I'm going to talk a little bit about the methodology of the report. So this report is a snapshot of all issues described as of November 2020. So we did update the RDAC section through December because we had exciting passages of RDACs in Massachusetts and Ohio in that month. And so we've updated those, but everything else is an issue described as of the data in November 2020. So that means that current legislation and 2021 changes are not reflected in states' grades. The appendices, if you click on those, include detailed data where you can really get into how we went about grading all of the states. And each topic also contains a methodology section, as I outlined in that video. So if anyone has any questions, you can ask questions in the chat box, or you can also email the policy team at policy@rarediseases.org, and they should be able to answer any questions you might have about the state report card as well. So now I think I'm going to hand it back to Jana.
I think you're muted there, Jana.
Yep.
Thank you. I was keeping it quiet on this end. As I said, we've already gone over a little bit about the RDACs with Anissa and the Rare Disease Advisory Council. And we are very excited because from a patient perspective, I can say when issues have arisen over the years that I myself have worked on, you know, starting out with this advocacy, I had to find someone to hear my voice, find someone to hear what I needed. And that's basically how things have been achieved with on the legislative end. And, you know, I found Delegate Murphy at one point when I previously had worked with Delegate Anderson. So it's finding that voice and someone who cares enough to listen to you. And it's really hard because there's so many issues that affect the rare disease community. And it's really hard to, you know, you pick one and you find that person to work on whatever that is. So to have these advisory councils, it creates that body where, you know, we don't have to hunt someone down now. It is a whole body of people who we can really go to, and we have the listening ears, and we can work together to address these needs and find solutions and ways to meet them. So that's what's great about RDACs and why we're so excited. Next slide. So now I would like to introduce our speakers. We've got some great speakers. Megan O'Boyle is going to be our first one. And Megan is a parent and an advocate, and I will let her tell her more about herself. But I met Megan at Children's National in the LEND program, oh gosh, probably 15 years ago, maybe. I'm not really sure. You know, time becomes a time warp. But we've met, we connect together, we've seen each other at NORD events, and we're both very passionate about advocating for our own children's rare disease. But we are, you know, like she's also a great advocate for rare diseases in general. And Megan's doing some great things, and it's just so great to draw her into this again. And that's what we do. We patients and caregivers, we tap into each other when we need to. And Megan's pulled me up to Georgetown a few times for some other things as well. So Megan, welcome, and you have the spot.
Thank you. Thank you for having me, and I appreciate everybody being on tonight. I know we all have a lot going on these days. So I'm Megan O'Boyle. I live in Arlington, Virginia, and I have a 20-year-old daughter with Phelan-McDermid syndrome, which is hence the PMS, it's not what you think. It was originally 22q13.31 deletion syndrome, and that doesn't really fit on a check. It looks like, you know, dozens, if not hundreds of other syndromes. It's a genetic cause of autism, epilepsy, developmental delay, intellectual disabilities, and some other medical complications. And so we have one foot in the common diseases of autism and epilepsy, but most of what we have to do is navigate is in rare disease. I'm very fortunate to live in Virginia. I was born in DC, and I'm sure I wouldn't have the services I'm getting here. And we are fortunate to be on the Medicaid waiver. As Shannon approaches the age of 22 and will be released from school, we're in a bit of a panic of, what are the services we will be able to get, and will we be able to continue to care for her the way we need to as we age. One of the things that has recently come to my attention about the Medicaid waiver is we were recently in the hospital with Shannon, and my husband was at work and I needed help, and I brought one of our attendants. And when we went to be admitted, they said parents only. And I said, one, you don't want my husband here. He doesn't like hospitals. And two, this attendant is a nursing student from Georgetown. When we go to hospitals, we need a second set of hands if we want to be able to, walk away from the bed. And currently the attendants are not allowed to be in the hospitals, then they're not allowed to be paid, which means if you're in there for a long time, then the attendant has to go get another job to keep up their income. So, if there's anything I can do in terms of speaking for improving those services for Medicaid. One of the things, and I don't know that this can be done specifically in the state, and I'm sure Dr. Sumner could attest to this, but all of these diseases are rare, and we're ultra rare, but they're underdiagnosed. And that's because there's not widespread genetic testing where there should be. And not everybody is being referred for genetic testing. And all of these syndromes, almost all of them, are underrepresented in minority populations because they're not being genetically tested. This has many effects, one of which is when and if there's clinical trials, there's not enough patients because we're so rare because we haven't found our patients. And the other two is, my child would be identified as developmentally delayed and autism. It doesn't say anything about the fact that she's at risk for heart issues, renal issues, lymphedema, and other medical complications that are part of her rare disease. If I only thought she had autism, I wouldn't know to screen for those things. Our medical bills would be, much higher because we wouldn't be preventing, and so on. The other thing that has affected rare disease families is the coverage of generic only medications by insurance companies. Many of these rare diseases have incredible complications and they require cocktails of specific drugs, and generic is not always going to be effective. So parents have to make the decision. Do I pay out of pocket to give my child the best treatment, or do I give my child subpar treatment because that's all I can afford? I could talk to you all day long about rare disease and all the things that we could do as a community to improve care and education and social services, but I want to give time to the other speakers. So again, I'm glad you're all here and I appreciate the opportunity to talk. Thanks so much.
Thank you, Megan. Okay, our next speaker is Greg Joseph, and he is also a patient, and we met Greg in our monthly virtual sessions, webinars that we've been having throughout the year, just to kind of check in and see how our rare disease community is holding up with the pandemic. And Greg has been a faithful participant along. So Greg, introduce yourself and share with us.
Well, thank you, Jenna. By the way, there's an S on the end of my name. It's Greg Josephs, but I'm very glad to be here and help others by sharing my story. As Nord says, alone we're rare, together we're strong. I was diagnosed about 18 years ago, and since every day is another day in paradise. See, I don't have a journey, it's more like an odyssey. A journey is planned, but mine is new every day. Besides myasthenia gravis, I have an anacroid cyst, dysthymia, MGUS, sleep apnea, name it. But let me say, my exercise program is my walking my Beagle Remy. I shuffle, but we do go a short distance every day. One glorious spring day, sort of like today, and it will come. He peed on a flower bed. Just then, a lady walked by, and I stammered embarrassingly, "He's just smelling the flowers." She said, "We should all do that more." As we parted, I thought, yeah, we should. So please stop during your busy day and smell or stop and count your blessings. Now, I have something called resilience. It's the silver lining in my MG, since I'm more apt to be in touch with my ability to ride the wave. The ingredients of resilience I've found are the mnemonic device POOF. Yes, POOF. First, positivity. George Carlin, the dean of stand-up comedians, once said, "The glass is not half full or half empty, but I see it as twice as big as it should be." There lies the perspective I think everyone should have. NORD needs to educate and inform our lawmakers, thank you, Delegate Murphy, to make sure the glass is the right size. Now, O is optimism. Before MG disabled me, wretched thing it is, I was a realtor for 20 years. I learned problems are not obstacles, they're opportunities. So it is with MG. A doctor once said to me that he sees optimism as a way to cope with life. Optimism leads us to look for solutions and silver linings when hardship strikes. I think Jerry Garcia said it well too. But back to Mr. Carlin. He also said, just because you get the monkey off your back doesn't mean the circus has left town. Now finally, F, ending poof, and also me. Good old Tom Edison said, "I have not failed. I've just found 10,000 ways that won't work." Last night, my son visited for the week before he starts his new job, and we played Scrabble as a family. I thought, I can make this work, but then I forgot about it. So I made a joke out of it. Fortunately, I was playing with my family, so they did something else while I was trying to form another word. Well, in summary, POOF, positivity, optimism, failure. It's okay to fail. Our 7,000 rare diseases leave poor health and economic woes. For instance, last June, I coughed so much I had to go to the ER. As it turns out, I just bruised my intercostal muscles, the ones around your ribs. So please do what you're able to, as long as it involves POOF and new limits. Thank you, Jana.
Thank you, Greg. You've got such a great outlook and perspective, and we've enjoyed that, and we'll enjoy continuing to hear from you over the next months. It's really great. So now moving on, our next speaker is Dr. Marshall Sommer. He is the division chief of the Genetics and Metabolism Center Clinic at Children's National, but foremost the director of the Rare Disease Institute of Children's National, where it just finally opened up in its new location at the old Walter Reed location campus from the Army had. He is also on the medical board of NORD and was the former chair of the board of directors. So Marshall, handing it over to you. Welcome.
Thank you so much, Jana. Let me do a screen share here. If someone could unshare, I will share. Thank you. And it's kind of funny. Historically, I have Virginia roots. If you go back to the 1600s and 1700s. So I'll claim Virginia roots, and then the family moved to Tennessee after that, and then had to head back up this way. So I'm honored to be here. And first thing is, congratulations on getting the RDAC bill through. That was fabulous piece of work there. Obviously, a lot of people contributed though, but having a legislature to actually back that just is a big deal there. So really congratulations on that. The building you see here is actually the last of the standing ward buildings from the original Walter Reed campus. We completely gutted it and renovated it, and it is now the Rare Disease Institute building. We see over 8,000 to 10,000 patients a year with rare diseases here of all ages. My oldest patient's 94, and our youngest one hasn't been born yet. So we take all comers here. It's a beautiful new facility. We also have a huge research building next to it that will be opening in July, where the primary focus is genetics research, which is primarily rare disease research. And for those of you looking for a venue, we also have a 300-seat lecture hall there that we got from the Army as well when they turned over the property to us, that has got state-of-the-art sound and lighting, and we would be more than happy and excited to do events there around rare disease, and we'll help you out with that. Our program here, just very quickly, we have 13 clinical geneticists, which makes us currently the world's largest clinical genetics program, 11 genetic counselors, and just really have enjoyed working in the state of Virginia. I serve on the Genetics Advisory Board, appointed from the governor's office for that. We also serve on the newborn screening committees there, and then we are the official follow-up program for newborn screening for Northern Virginia, but also for a lot of the rest of Virginia as well too. We work very closely with the other hospitals in Virginia. Virginia Tech actually is going to have a research team up here at our campus on the old Walter Reed property. We work with Virginia Commonwealth. We have a number of good projects going there. King's Daughters, Charlottesville. There's just so much going on in rare disease in Virginia from my standpoint. I thought I'd make a couple of points about rare disease. So I've been a rare disease professional since 1985 when I went into clinical genetics. And there's a couple of things you might find useful. Obviously, it's a changing disease model. It used to be acutely diagnosed, but now it's becoming more and more of a chronic disease model. Consistency of care is really one of our top priorities, and predictability for patients around both care, but also around diagnosis. Sort of, you've got two sides of that coin there that we want to work on. And the rare disease workforce is too small for traditional care models, which you can either wring your hands and say, oh, poor me, or you can kind of say, well, we have license to go out and try new things, which is what I actually prefer. Here's one thing I want to show you. This is actually some data from Spain showing that the death rate for patients with rare disease has been steadily declining since 1999. And actually, this curve has continued to bend. At the same time, the number of rare diseases that we can diagnose, when I started my career in '85, I could diagnose about 24 diseases accurately. I can now diagnose over 8,000 diseases. We are describing 9 to 10 new diseases tied to a genetic change per week, not per year, per week. So this is a field that is incredibly dependent upon informatics and bioinformatics, computational biology and everything else. It's about the only way to keep up with these things. There's some really great work going on at Virginia Tech. We've got some good joint projects there, but other groups as well too. But it's something we spend a lot of time on. The other thing I should say about our program is we're the training site for the NIH Fellows in Genetics, and we do a lot of work with both the National Human Genome Research Institute and others around these topics. Now, therapies, what's going on there? There's about 600 plus, but the thing you need to remember is almost half of the approved therapies from FDA every year are targeted around rare disease. So we've gone from only a handful of therapies in 1983 when the Orphan Drug Act was passed to 600 plus with new ones being developed every year. And just as a good check on that, gene therapy, of course, is targeted at rare disease. I think there are over 400 investigational new drug filings at FDA to look at gene therapy trials, gene therapy studies going forward. And Jana, I'm going to keep my 10 minutes like I promised.
Hi.
Now, one thing we talked about earlier is that the life expectancy is going up. This is a trend. 1980s Down syndrome, average life expectancy was the 20s. Now it's pushing 60. Sickle cell anemia, same thing. Huge jumps in life expectancy. Cystic fibrosis, almost every single rare disease is moving from that acutely diagnosed, we're so sorry you have this, to this, we've got you diagnosed, now we've got to plan a lifetime of treatment for the condition that you've got. So these effects we're seeing because of new treatments, of better coordination on care, where the states are helping to provide better care for patients. But now we're moving into a chronic disease model, which gives us a whole new set of things to deal with. Just to kind of give you an idea of impact here, I looked at over 800,000 visits at Children's over a 3-year period. 12% of those patients had a diagnostic code for a rare disease, so an ICD-10 code. It's probably higher than that. On our inpatient visits, 18% of our inpatients were patients with a rare disease, and that's over 70,000 visits. If you came to a children's hospital more than twice, and these numbers will hold up across almost every children's hospital out there, if you came more than twice, 32% of the patients have a rare disease. So while we talk about the diseases being rare, and once again, my congratulations to the legislature, because a lot of legislators, when you talk to them and you say rare, they're like, I don't need to worry about that. But when you actually put it all together, you take those 8,000 conditions and you look at them in mass, it is a huge impact on the healthcare system, and one which we must pay attention to. So how can Virginia lead? So this is the question Jana actually asked me to address. How does Virginia take leadership roles around rare disease issues? Well, one is we need to work on broad access to genetic testing. This is one of the key things. It's not a panacea. For instance, with myasthenia gravis, it's not going to be a huge impact, but for the bulk of these diseases, this is how the diagnosis gets made. And it's an equity issue. I just pulled the data from Kaiser before coming on here. 38% of children with special needs have Medicaid in Virginia, but most of those patients can't get access to genetic testing. It is shown to improve outcomes. Study after study have shown making the diagnosis helps the patients do better. Another place I think Virginia can become a leader is the use of telemedicine. We found last year that we decreased admissions for patients with known genetic conditions by 25% because we were able to better track them. We were also able to keep them safe at home as opposed to coming into the hospital to see us for needed care by using telemedicine. So it can be transformative for rare disease. It's also an access issue for our rural families, families that cannot get out, cannot move around, can't get into the hospital for either regular visits or even for the diagnostic visits. It's a way to extend that care, which makes it an equity issue as well too. It makes it so that we can see patients that otherwise wouldn't have access because they don't live next to a university, they don't live next to a major medical center. So for me, telemedicine is a big one. Virginia has not yet joined the Interstate Medical Licensure Compact. One of the things we talked about before is there is a dearth, there is a shortage of care providers in this field. And when you identify a patient with a rare disease, there may be one expert on that, and it's the likelihood they're going to be in your state no matter where you are is only about, maybe 1 in 30, 1 in 40, something like that. So being able to access the expertise wherever the expert is and matching them up with the patient, I think is key. The Interstate Medical Licensure Compact, where physicians can talk and work with patients across state lines, particularly for rare disease, is very important. Research, a lot of research going on down there. I'll have you know that actually there's a new therapeutic compound developed out of Charlottesville from a Virginia-based company that is going to, I think, be very transformative in some of the diseases. So there's a lot going on there. But as a state, where can you really make an impact? Well, you've got a population that actually covers a lot of spectrum. You've got urban, you've got rural, and you've got a diverse population. So you've got a balance of patients that a lot can be learned from that other states may not have that same advantage. So things around epidemiology, natural history, and care delivery are certainly places where Virginia can contribute to the body of knowledge in rare disease. And finally, where else can it lead? We talk about care providers and pulling people into the field. One of the ways to do that is to make sure that services get reimbursed so hospitals can afford to hire. If they can afford to hire, we can bring more people in, and then we can do these things. Telemed, we talked about a little bit. I want to stand in my tent, and I thought it was great, Craig, that you did the glass of water, because I use the glass of water reference too. For me, the glass of water is always 100% full. Now, sometimes it's half air, sometimes it's half water, but you know what? What you put into the glass is what you get back out of it. So thank you all very much. I appreciate the time. I'm very excited about doing this. I can guarantee you that my program will put in whatever we can to help, and you can count on us.
Thank you, Marshall. That was really great information. And we will see him again. Our next, yeah, our next
unfortunately,
speaker,
I got to duck out now. My apologies.
That's okay. Thank you so much for taking the time.
Bye, everybody. It's great to see
Bye-bye.
you. Congratulations again.
Take care.
Thank you.
Be safe.
Our next speaker is Leslie King. She is the Director of Marketing at Leadient Biosciences, which used to be Sigma-Tau Pharmaceuticals when I first met Leslie. And I met Leslie 19 years ago on a listserv for families of kids or family members with metabolic disorders, because her company makes Carnitor, which is the orphan drug that my two children need for their metabolic disorder, and many other conditions use it as well. So Leslie and her company are committed to rare diseases, and I thought she would be great to come and give us an industry perspective on the importance of an RDAC and just from their pharmaceutical perspective for the rare diseases. So thank you, Leslie.
Thank you, Jana. Thank you for inviting me to this really important panel and discussion. And of course, congratulations on the RDAC bill. That was exciting to see that. But Jana, I mean, really, we're like family at this point. We've been together for a long time. Like Jana said, first of all, my name is Leslie King. I am, in fact, with Leadient Biosciences, and we've worked in the rare disease space for over 40 years. It's too bad Marshall's gone, but we've been in the rare disease space since 1984. I think he says he's been around since 85, but didn't want to admit it.
I'll let him know.
So, and I am honored to have worked at Leadient Biosciences and in the rare disease space for over 20 years. I have been with the same company. We are dedicated to rare disease, and because of their dedication, I can't see myself anywhere else. We truly are focused on rare. So with Jana's invitation, I graciously accepted. Partnerships with industry and advocacy are incredibly important. And I spend a lot of my time focusing on understanding or trying to understand, because I can never understand the journey of any patients, their families, the caregivers, the healthcare professionals that worked so diligently to help for the best outcomes for their patients. And all I can do is my part to be part of that process and have an impact on that journey, or as Greg said, the odyssey, his odyssey, whatever it is for that person. And equitable access is a huge barrier. Dr. Sumner talked about that. And equitable access can be a huge barrier to adherence and ultimately positive outcomes. It's important to understand as industry, and sometimes industry doesn't always understand the insurance challenges that people may face, that patients' insurances change, and how can we as industry help ensure that there's no barrier to the medication, there's no gap in coverage, there's no gap to patients receiving their medication. These are sometimes legislative issues that come to the forefront. It needs to be addressed, and together we can partner to do that. There's challenges with pharmacies, the locations of pharmacies accepting your insurance or no longer accepting your insurance or no longer carrying a patient's medication. These are real problems that patients have to face. Accessibility. Do they depend on other people to get their medication? Do they depend on a ride to the pharmacy? Do they take the bus? If the pharmacy changes, that relationship with the pharmacist changes. Somebody who maybe they've been working with, Jana and I were talking about this recently, a pharmacist that you work with for the last 10 years who knows your story, and all of a sudden you have to change. It's like losing somebody who's been on your journey with you the whole time, and you don't have a choice. You have to make a new friend, and you have to educate that friend on your whole new journey. It's tough, and these are challenges. Are there challenges physically? Can patients physically access their medicine? Can they open the bottle? Can they push a capsule through that foil packet? Understanding all of these challenges is really important, and that's where the partnership with industry is really important with advocacy. So we understand. We'll never completely understand, but we can help with knowledge. So it takes a village, and as a village, we feel that industry needs to have a voice in there so that we can help. We can listen and help bring out better access. Greg, you mentioned also that you need to stop and smell the flowers, and we want to provide that opportunity through easier access. And you have enough battles to fight. We want you to stop and smell them. Let's make this path easier. And we do remember you are more than your disease. So just a little heads up, when I told somebody I was coming to this, and I was a little later on arrival, but I was chatting with a colleague, and he was excited to announce that tomorrow there's actually a report coming out on the title of the report is going to be The Economic Burden of Rare Diseases in the U.S. approached $1 trillion in 2019, surpassing cost estimates for many chronic diseases. So that's a huge number, and we really need to think about the greater rare disease space and how we can all partner together to bring out the best outcomes. Thank you.
Wow. Thank you, Leslie. That's quite informative. You touched on spots that I think all of us can definitely relate to. And, if we sit down, and I'm sure all of us who come from the patient side of things could put out our dollar figures and that we know have contributed to that amount, that I know all of us will probably really love to see that report at some point. But all of these issues that each of you have mentioned and spoken to, that's why these RDACs, these rare disease advisory councils, are so important, because so many of us run around in silos trying to meet our own individual needs when they are needs that mimic everyone's with a rare disease in some shape or form. And we spend so much time trying to either be that caregiver for someone or be that patient in dealing with the health issues. If we can possibly alleviate some of that running around aimlessly trying to find solutions, we can definitely have much more quality and productive lives and meet those needs in a way that everyone should be entitled to. It's, you know, when we talk about equity these days, I listen to a lot of that, but I think, you know, there has to be equity with the rare disease community. And that's why these RDACs are going to be so important, because imagine we are just a small component of people having this discussion here briefly this evening, but imagine a table with all stakeholders around bringing these issues to that table that don't have to be issues, that we can find solutions. And with that, I thank you again, Leslie. This is great. And we will move on to our next speaker, who I am so proud to announce, introduce to you, Delegate Kathleen Murphy, who was so gracious to become our rare disease champion a few years ago. And I hit her up for a few different things. And we, you know, together put together the caucus a few years ago. But last year we addressed medical foods, but this RDAC is so huge, because so much can be achieved with an RDAC, and she went at it. And in a year with the pandemic and having only 7 bills to be able to put through, Delegate Murphy chose our RDAC bill, HB 1995, to be one of her 7 bills. So I'm not going to take any more, but I want to introduce you to her, and you have the table. You have the floor.
Well, thank you really so much. I want to praise Jana simply because when I first came to the House of Delegates, which was 7 years ago, you know, you always want to do something meaningful. But almost the day after I was elected in a very cold special election, a parent came to me, and his name was Dick Michaud, and he had a granddaughter who has PKU. And he tried to explain it to me, and he said, "What can you do?" And I said, "Well, I'll put in a bill." And it was one of my first bills was to try and get funding for the medication for PKU. And I did not even have any idea how complicated this would all get. But along the way, I met Jana and Stephen, and she began to be my guide. And so I'm very, very grateful. And when I said, what can I do? We formed a rare disease caucus. Doesn't have a whole lot of members, but we're growing. And then I said, what can we do next? So we named a rare disease day. And then this year I said, okay, what can we do next? And she said, we need this council. And so I said, okay, this is our job this year. And fortunately, really, because I'm a Democrat and the Democrats are in power, you know, it wasn't as hard as it had been. It wasn't, I didn't have to beat people over the head and beg and plead. You know, I had 5 bills that I could get funded, and so this was one of them. And I'm really, really pleased. And Dick Michaud was so shocked that we actually finally got the medication for, or the formula for PKU declared a medicine and be covered by insurance. I mean, it was just such a small thing. And I would be so frustrated. And I would go sit in Kathy Byron's office, she's on the HERC, and I would explain it to her. And I kept thinking, if I could only say it right, you know, what is the way, what are the words that I need to use to make her understand how important and how life-saving this is. And I figured out that I have dogs and she is a dog lover. And so we began to trade dog loving stories, and it really helped. And finally, we got her on board, but it took it took us 5 years to do it. We have a daughter who has cystic fibrosis. Believe me, I understand. I understand the worry that you have when a child can't breathe, when she needs her medicine, when you send her off to school, when you send her to a party and somebody's got a cold. I know what this is like, but I never thought of it as a rare disease In fact, I still am unaware whether it's really considered to be a rare disease, but I know how hard it is. I know how much work it takes. So for me to, embrace this really wasn't that hard. And Jana made it that much easier. So she's my superhero. I am grateful really for being on this conversation because I wrote down several things. We need more funding for genetic testing. We need to make sure aides can be go into the hospital with patients and make sure they can still be paid. We need telemedicine and we need more genetic testing. So this means that for next year, Jana, we're going to have to sit down and figure which one of these is going to be our next bill. But I'm not anybody's hero. I'm just somebody who cares. And I was determined not to let this fall between the cracks because it's too easy for people to overlook it. And so I may not have found the cure to anything, but I certainly found a way to make the conversation easier. And so I'm proud I've been able to do that.
And that's what's most important, is finding a way to have that conversation. And that's why these RDACs are so important. So we can't thank you enough for making that happen. And hopefully you won't have to sit at the table as the only legislator there who is interested in, but that more will gather around and be a part of that conversation so that we can address all of these needs that come to each of us. So we are thrilled. Thank you.
I know that Eileen Fillercorn has been a real advocate for you as well. And the fact that she is the Speaker of the House should be something useful that we should tap into.
Definitely, definitely.
Maybe we could give her a zebra.
Definitely can do that. We have access to our zebras.
Yeah, let's just pull her in and give her a zebra.
That's awesome. When do you expect our bill to be signed?
I don't know about signing yet. I know that we expect to be finished with the work of the House. My dog now wants off the sofa. The House of Delegates by Saturday afternoon sometime. So then we'll make our calls over. Let me get her off the sofa. Minnie, you just woke up at the wrong time.
I love it.
Okay.
My dogs are being so quiet right now.
Yes, well, she can't get off the sofa by herself. She's too little. But anyway, so when we're done, probably on Saturday, then after that, the governor will step in and start notifying us when he will have bill signings. This is a bill I would like to be there for a signing, so I am going to ask him for that. And I'd, of course, Jenna, like you to be there as well. But I don't know how all of this, isolation will continue to work. I am, because our daughter, unfortunately, has been diagnosed with stage 4 pancreatic cancer. We'll be heading out to stay with her for a part of April.
Mm-hmm.
So it won't be the first part of April. I can, unless he signs it without me, and in which case you can get Eileen to go with you and you two can stand there and take a picture for me.
I would be happy to go down there for that. Yeah. I'll wear 3 masks if I have to.
We'll all stand 50 feet apart in the giant room.
Exactly.
I would like to be there, but we really, someone asked me, how did I get here? And I like to say, because of the love of a grandfather, because he cared so much that Dick Michaud came to me and he said, I need your help. So you can blame him.
No, it's really great. And unfortunately, that seems to be the way that a lot of issues like this when it comes to health related issues get the attention, it's because someone finds somebody like you to be that set of ears to listen and take that time and pursue it. So we just can't thank you enough. We're really grateful for that. And as far as next steps for our council, we will wait to hear for the bill to be signed into law. And then stay tuned, everyone, because the next step will be to have a coalition meeting so that we can pull together lots of voices of the various stakeholders to set the groundwork, the foundation for what the council will look like. If you have not been able to take a look at the description of the bill and the council, and I definitely advise you to pull up House Bill 1995 on the Virginia General Assembly website. And also on the NORD website, it's Project RDAC. And it will give a really good description as well as why these councils are valued and why they are being developed and how they can help the rare disease community. So they're very good resources there to educate each other on what's this all about and what does it mean for all of us.
I would make a suggestion here, Janet. Write a note to Luke Torian, the Chair of Appropriations, and say thank you.
Well, next time I see him over at the golf course, I'll even do better. I'll go up to him.
Well, you know, he's got an ego, and you can make him feel good.
Most definitely. He's local here, and I know he's got a soft heart too.
Yes, he does.
We've seen him in action. He's actually met Stephen, so he's definitely a way to get to him. So I will definitely do that. Thank you.
Okay.
Thank you so much. And moving on, Delegate Murphy is our last speaker. So what I wanted to make sure I point out to you all, this is a short time to cover a lot of information and a lot of background information that is behind all of this. And if you go to any of the NORD or RAN, which is Rare Action Network resource links, you will be able to learn anything and everything you would like to know. Virginia's Rare Action Network has its website with the rareva.org that is, focused specifically on Virginia. We also have a Facebook page that we try to constantly keep updated. If you don't go to the NORD page, we like you to go there because we try to keep everybody enlightened and up to date with what's happening with NORD, and in particular any state related issues or events. But NORD's website is rarediseases.org. That is the home base of everything. That is the umbrella website that you can find anything and everything on. It's very resourceful, and I encourage everybody to take a look at it sometime and to educate yourself more, learn more about the Virginia State Report Card. Go to that website as well. It has its own that Allison demonstrated, and it gives very specific details behind each of the topics on the report card and why each area got the grade that it did. So we have definitely improved over the years. There's always room for improvement, and I am confident that as our council becomes a very active and functioning council, I think we're going to see changes there for the better. So it's going to make life so much easier for everyone. So next link. Allison, this is Allison's turn.
All right, so we have some Rare Disease Day swag bags that NORD has put together. And we're going to be doing a drawing to send out I don't remember how many, some of these swag bags to people who joined this call today. So we are going to be doing it after the call, and you will receive an email if your name is drawn, and then you will get the box sometime in mid-March. So we're excited about the NORD swag bags. So keep a lookout for that in your email. I think that's it on the swag bags. So the next slide, we've got another video, and hopefully it works.
Preview here, Janet.
Every year on the last day of February, the National Organization for Rare Disorders joins together with others around the world to raise awareness of the challenges faced by people living with rare diseases. Achieving health equity is even more difficult for rare patients. To have equity in health means everyone has an opportunity to be as healthy as possible, regardless of social, geographic, economic, or other obstacles that may be working against them. At NORD, we appreciate your support, which allows us to work on issues like health equity and many others, and for our staff and volunteers to bring them to the forefront on Rare Disease Day.
From the volunteer state ambassadors, we would like to say thank you to all of our Rare Action Network supporters for helping us connect with rare patients and families in our states.
And thank you for allowing the Rare Action Network to raise important issues with state lawmakers on Rare Disease Day and throughout the year.
Did you know that in medical school I was told when you hear hoofbeats, think horses, not zebras? But what about the more than 25 million Americans living with a rare disease? At NORD, we are humbled to provide help and resources to our zebras and their caregivers.
NORD support allowed me to catch up on some overdue bills, including my rent. Thank you for your support, NORD, and thank you for supporting Rare Disease Day.
From all of us at NORD, thank you for your dedication to the rare disease community on Rare Disease Day and every day.
Great video. Thank you, Allison. And I wanted to jump in, and if you aren't a winner of a swag bag, you can go do shopping on NORD's website. There are fun things that you can go to and purchase in there. So it'll bring you to, it'll force you to have to go to the NORD website and look around, because there's some fun things on there that you can have access to. With that now, we wanted to open it up to see if anyone has any questions for anyone, any of our speakers that are still on, or any of us here from NORD. I know we've got lots of great comments on the chat box, but if you have a particular question or comment, you are welcome. Quiet. Okay, well, with that then, I think we're gonna go ahead and wrap it up. We've really appreciated our speakers tonight. I think we got so many different perspectives that everyone can relate to, and it gives us something to go away and think about, and gives us a direction to go as we move forward with our Rare Disease Advisory Council. So we're celebrating that tonight. Recently, it literally just passed last Thursday, I guess it was, in the Senate, and it's been a process, but it's been a welcomed bill in the House and the Senate. It has passed through every subcommittee and committee unanimously, and on the House and Senate floor unanimously. So I think by doing so, all of those people, we have their attention. And I think we can do some great things with it. Allison, do you have anything else you'd like to provide?
I just put in the chat that we do have a link up on the NORD website if anyone is interested in sharing their story as a rare disease patient or a caregiver, family member of any, whatever your connection to rare disease is. I put that link in the chat box. And I also do just want to plug kind of quickly that there is another kind of volunteer role available within the Rare Action Network. It's called the Community Engagement Liaison. I used to be Virginia's, but now I work at NORD as a full-time employee. So I am no longer in the Community Engagement Liaison role, but Jana does a lot. And if anyone is interested in getting more involved with the Rare Action Network in a more involved volunteer capacity, I'll put the link to the Rare Action Network's application for being a state ambassador, community engagement liaison in the chat box. There is like a process of the application and everything, but I definitely, if it's something you're interested in, I encourage you to email Jana, reach out, and potentially apply. So
thank you. Yeah. I was sad to lose her, but it's great to have Allison in another capacity with NORD. And like she said, there's always room for anyone to step up and do a little more volunteering, whatever you can provide if you are interested in. So don't hesitate, or if you even have questions about it or know someone else, we definitely encourage. We're going to need it with this RDAC coming into fruition. So the more the better, the more voices, the stronger we are. So you've got all those links, lots to look up. And as you know, Sunday is Rare Disease Day officially. So we're excited. So take a little time out and pay attention to what's going on online. I think there's a few other things. There's another event. There are different webinars, and we'll always have things posted on the Facebook page as far as, different webinar opportunities for you to participate in, listen in on. So if you haven't joined our Facebook page, if you're on Facebook, please do. There's always some good links, and there's been a lot of webinars coming up. Another issue that we didn't even bring up, obviously, is the whole COVID-19 topic and how that impacts the rare disease community. But besides that, it opens up people's ideas and minds of how does a pandemic like this affect not only the general population, but what does it mean for the rare disease community? So we are fortunate to every now and have a webinar with someone from the FDA to give updates about it. So stay tuned. There's always opportunities to learn, to see what's happening in the rare disease community and how it might benefit you. But I want to thank everyone for joining us tonight. I know it's kind of never a perfect time, but at the end of the day, but we're just excited to do this because we did not want Rare Disease Day to go by without us having an event here in Virginia and just an opportunity to share everything that we could tonight with you. So thank you to all our speakers that are still here, to the ones that had to step off, especially Delegate Murphy. She's very accessible, so if you want to send her you can always send an email to thank her on her site, or Twitter. There's Twitter too. But again, thank you for taking the time out to join us tonight, and we wish everyone well and look forward to the next time we can engage with everyone. So thank you, everybody. Stay well and be safe.